As more Americans get older, there is a dire need to create an age-friendly healthcare system, but currently there just aren't enough doctors specializing in geriatrics to care for older adults.
So what's being done and who's stepping up to handle this critical care for seniors? Jennifer Bisram covers aging and care and has the latest in this installment of the cost of caregiving.
We do not have enough geriatricians. We do not have enough primary care physicians or practices equipped to care for this population.
Dr. Maria Carney says the time for geriatricians is now, and as the aging population continues to grow, the need will soar. She should know she's the chief of geriatrics at Northwell Health and the author of The Aging Revolution.
If we don't address this aging crisis now, then where are we in 10, 15 years?
I think it's going to impact families greatly.
According to the American Board of Medical Specialties, New York State has 641 certified physicians in geriatric care for a population of 4.6 million New Yorkers 60 years and older. That equates to one geriatrician for 7,100 people.
We have not built outpatient practices to help a growing population with multiple medical problems who may have functional needs and care needs. It's still set up like it was 20, 30 years ago.
Angela DeCapreris Salerno talking with us on her 80th birthday, remembering her first visit with her geriatrician several years ago.
She wasn't looking at me like I was some 30-year-old. She was looking at me, a person who was in my 70s. As we get older, our metabolism starts slowing down, so we can't take the doses that other people take. We're more susceptible to infection because we're older.
The bubbly and still very healthy Long Islander says now every time she steps into an examination room, she feels comfortable and genuinely cared for, the compassion being felt through the stethoscope.
Do you need any refills on that?
Not for that, no.
Dr. Sukhminder Sahantra is her geriatrician.
It's a very special population. They have such stories that they've lived throughout their lives, and those are still part of that, and it's part of their care, and it's part of helping them continue to age as gracefully as they can.
The 42-year-old doctor who works at NYU Langone's geriatric medicine office in Mineola says despite the longer visits and complexity of care that comes with treating multiple chronic conditions at times, she's passionate about her patients.
I love when they'll share things. I've learned things. Sometimes I'll do things that they said they've done. It also reminds me of my grandparents as well, the lessons we've learned from them growing up.
Elder care advocates say geriatricians make less than most physicians and specialists. According to the American Medical Association, about $258,000 annually compared to an average of $350,000 annually for many physician salaries. Elder care training, they say, is also not required in all medical school programs, making it harder for doctors to specialize in this field.
We need more geriatric training. We need it in physicians. We need it in nursing. We need it in nurse practitioners. We need it in social worker. We need to improve the workforce to care for older adults.
What's your advice to people at home as they age?
If you feel that you're just being looked at as a number, go and find yourself a geriatric physician who will look at you as more, because they know what's happening to your body as you age.
Addressing the aging crisis one doctor at a time. Jennifer Bisram, CBS News, New York.
And you can find all of the stories in our Cost of Caregiving series on our website, including a calculator to help families determine how much care could cost them. It's all at cbsnewyork.com.